Ladies and gentlemen, please welcome Shira Gerver of AstraZeneca.
Good afternoon, everyone. I'm Shira Gerver, Vice President of Oncology Corporate Affairs, and I'm proud to be here with you today representing AstraZeneca. In cancer, our mission is to eliminate cancer as a cause of death. And we know we can't do that alone. And every day, our teams are working around the world towards that goal, partnering with governments, with academic institutions, with health providers, with patients, and so many others to improve the care experience for cancer patients and improve outcomes through collaborative cross-sector partnerships. And despite the significant progress that's been made in cancer in the past few decades, through scientific innovation, through increasing access to screening, the burden from cancer continues to increase dramatically around the world. The numbers for breast cancer specifically are staggering. Today, there are still an astounding number of women around the world who die every year from breast cancer, 2,000 every day, or 2 deaths every 1.5 minutes. And it's important to keep in mind that a large majority of these women diagnosed with breast cancer are women of working age, women like me and many of you in this room. And this is not only a devastating burden for those women and their families, but it also impacts entire economies, communities, and nations. This is sobering on so many levels. We know that women's health frequently ends up on the back burner of policy priorities globally. In our research and our conversations with policymakers, clinicians, with the whole ecosystem, we've consistently found that breast cancer is not being prioritized within global policy agendas as it should be. But there is enormous potential for change. We could boost the global economy by $1 trillion annually by 2040 by just focusing on and investing in improving women's health outcomes, according to a McKinsey report. And crafting better policies to improve women's health, with improving breast cancer care and outcomes as a foundational starting point, not only helps women live longer and healthier lives, but also benefits families, communities, and indeed national economies. For too long, the breast cancer policy conversation has only focused on improving screening. But we're ready to talk about more than just screening in breast cancer. And many countries and leaders haven't followed through on national cancer plans that address the full continuum of care, or they've cut funding or support to these plans. But this has huge consequences for their constituents. There's a lot of fear. Women have told us they're afraid to get screened for breast cancer because they don't know if their treatment is going to be covered. They're worried about the burden on their families, and they're worried about losing their jobs or that they won't be able to access care they need because of where they live. And this is not only heartbreaking, this has a wider impact on society as well. And I know that we can do better. Let's reduce the number of women that are dying from breast cancer from the 670,000 per year we see today. So many of these deaths are avoidable. And it starts with the political will to effect change, cultivated in rooms like this one. When everyone, not only health experts and patient advocates, but also finance ministers, world leaders, members of Congress and Parliament work together to make a meaningful impact on patients' lives, we will be able to make a difference for those millions of women each year diagnosed with breast cancer. Thank you, everyone, for joining us here today with this high-level discussion and with our esteemed guests on how we can all make a difference for women everywhere, starting with breast cancer. Now, I'm honored to invite to the stage to continue this important conversation Her Excellency Toyin Saraki and Her Excellency Eliza Reid. Thank you so much.
Good afternoon, and thank you, Shira. Breast cancer is the most common cancer for women around the world. The earliest descriptions of breast cancer date to ancient Egypt and Greece, more than 3,500 years ago, Yet it didn't become a public health issue until the 1970s, when US First Lady Betty Ford bravely defied social norms to speak openly about her fight against the disease. Since then, while survival rates have improved significantly, breast cancer remains a widespread public health threat. Yet women's health and breast cancer remain at the back of political and economic priorities. But there is hope. We're seeing voices outside of long-standing NGOs and health ministers call for major changes in how governments approach and treat policy. Committees in the European Parliament and in the Canadian Parliament, after a bumpy start, where 11 of the 12 Women's Health Committee members were men, and other legislative bodies are focusing on women's health as a broad policy goal, not just a niche discussion. The World Health Organization's Global Breast Cancer Initiative, GBCI, is a very powerful initiative and an example of international collaboration in breast cancer becoming the rightful global priority. The initiative brings together public and private sectors to transform breast cancer care by increasing access to early detection, diagnosis, and treatment. The GBCI is aiming to set a new standard for cancer care. We're at a crossroads as a society regarding how seriously political will, resources, and access will work for women. The question before us is this our moment to change the game for women everywhere regarding breast cancer? I'm so honored to be joined today on stage by Her Excellency, Madame Eliza Reid, the immediate former First Lady of Iceland. She is a leading gender equality advocate, a notable best-selling author, the co-founder of the Icelandic Writers' Retreat, and so much more. Madam Reid, thank you for being with us today.
Thank you.
You have been an incredible advocate for gender equality around the world, and you're coming from the most gender equal country in the world, according to the World Economic Forum's Global Gender Gap Index. How do you see the link between health and gender equality, especially on breast cancer mortality and gender inequality? And how can a more gender equal approach in policy and a whole of government approach help to create a healthier society?
Well, thank you very much, and thank you very much for inviting me to take part in this conversation about such an important subject. You are right, of course, that Iceland has topped the World Economic Forum's Global Gender Gap Index for the past 15 years, which is actually as long as they have been having the index published. And that is ranked on 4 different factors, really: political representation, economic empowerment, education, and of course, access to healthcare. And in Iceland, where we are closer than any other country in the world to closing the gap, some people look and think, well, you're basically there. You're a gender equality paradise. And we're very, very quick to say that no, that is not the case. And in fact, we have not closed the gap on any of those 4 pillars, including the healthcare coverage. And so it's a very, very important issue. And you talked about gender equality, of course, and gender equality is something that pervades my approach and a lot of the work that I do, because I know that working towards greater equality in all sectors is something that benefits people of all genders. That's not a zero-sum game. We know that societies that are more gender equal are not only richer, but they are happier, more peaceful, and longer living societies, men and women. So it's something that's good for everyone. Nevertheless, we still, as you said, see these challenges. We see somehow, and I think there's long ingrained traditions of some kind of bias towards women's health issues, not prioritizing them. And one of the things that I think that we need to be doing is what I call wearing the gender equality glasses all the time. It's thinking about that equality, diversity point of view in all facets of what we're doing, not just when we're thinking about a subject that is specifically on that topic. So when we're talking about health policy, when we're talking about advanced treatment and care policies, we need to think about how this is affecting people of all genders. I also would add, here in this room, obviously, we have people who are clearly interested or working with this topic. But one of the things that I find can be a challenge when we're trying to improve situations is thinking, Well, I'm not an elected official myself, or I don't run the company or have the budgets, and therefore all I can really do is vote for somebody who'll do a policy that I agree with, and then I'll just, wait and see what's going to happen. And I think that that is a very trickle-down approach to improvements. I think that we all need to bear a responsibility to thinking about how we can all kind of make the world a better place in this sense. And that includes talking about issues such as breast cancer.
That's a very amazing thing, because we say that change doesn't only come from the all too often glacial pace of legislative adjustments and public opinion shifts. It actually comes from stringing together many, many tiny, inevitable moments of progress.
Yes.
What do you see as those moments of progress that need to happen now for women's health to be more prioritized around the world? And how can leaders couple these with the necessary structural adjustments?
Lots of big questions. I think, we were on a state visit once and we met some activists who said to me, change is inevitable, but progress is a choice. Okay. And that's something that I think about a lot, because when we're working towards these improvements, again, it's very easy to tick a box or to say that we've done something or to say that we have reached a milestone, and then we never need to think about it again. And we all know that we can face backlashes, that there are new challenges and new situations that can arise that we need to address. So when it comes to areas such as tackling the inequalities in women's health, I think we need to show the data. Data is incredibly important. I think you and I, and hopefully many of the people in this room, would instinctively say, of course we should prioritize women's health and women's care, but some people may not agree with that. But if we show the data that shows how much more money, the increase in GDP that happens when you have healthy people contributing to your economy, really, really shows the difference. Secondly, I think we need to reduce stigma surrounding women's health, women's reproduction issues. And that is really important, and something that each and every one of us can do is to talk very openly about it. Every one of us in this room knows someone or has been affected ourselves with cancer. And we need to be able to share those stories and experiences to reduce the stigma about what is happening, but also for people who are being directly affected by it to know that they are not alone, to know that they have that sort of support. And that links to a third point that I would bring up, which is the idea of role models. Role models are incredibly important. And so people who have some kind of a platform need to step up and say, this was me. Or, somebody who had a mastectomy and say, I had a mastectomy. Or somebody who found a lump or who checks regularly, and they need to talk about that to influence other people. And I would add that every person in this room is a role model. And we may have different degrees of influence, we may have different degrees of contacts, but we all have an impact on those around us, those infinitesimal changes, those ripples that go everywhere else. And so we can really decide, do we want to use the voices that we all have to help amplify the voices of other people who may not be being heard, to share positive news stories, to share tangible, progressive things that we can all be doing, or do we want to sit back and let others impact the change?
It's exactly what we were talking about backstage, where as a First Lady, you used your platform of visibility and privilege to bring awareness to cancer. But as women, putting our health first can actually be very challenging. That can be a challenging obstacle to better care, better outcomes in action. How can we actually help women put themselves and their health first? How can we take off the burden of seeking care, getting treated, and staying with treatment off the woman's shoulders, of being her own broker, and actually make this a shared public priority?
One thing that I want to address that's a little bit tangential to what you said is I think the importance of making sure that we're targeting all groups of people. You talked about when I was serving as First Lady, and hopefully afterwards, to add a little bit of go off on an even more of a tiny tangent, and you would know this as well, that when one becomes the spouse of a head of state, for example, and in my situation it happened, my husband had never run for public office before, so it happened in a span of less than 2 months, and I had no idea that this was going to happen. And I had to Google how to curtsy because we were going to meet kings and queens. And all of a sudden you're known nationally as somebody's wife, and you're a little bit less known as who you are as an individual. And it took some time for me to recognize that I still needed to use my voice, and that people would listen to me and kind of get over the idea that I shouldn't talk about gender equality because I had a platform because of something my husband did. But one of the things I did was, if you talk about, say, breast cancer screening and also cervical screening in Iceland, we need to improve the rates of people who go. The National Healthcare Service offers that to everybody on a regular basis. For breast cancer screening, it's only 52%. But among women of foreign origin, it's 18%, significantly lower. You may hear from my accent that I am a woman of foreign origin. I was born and raised in Canada. And so I took part in campaigns to target that, because I know myself, when you get a flyer in the mail in a language that you may not master, you don't even look at it, right? And I remember for that campaign, I actually think this one was for cervical screening rather than breast cancer screening, but the same kind of thing. They did a photo shoot, and I had these huge photos put up in the shopping mall, which my children were very embarrassed about. They couldn't go to the mall while it was being hung up. But just to say that this is important for people, and maybe people in that community who saw me a little bit more could talk to me about it. You have to remind me the second part of your question again, because I had a good point.
How do we actually make it the shared public priority? Beyond the advocacy, beyond encouraging women to come forward.
Yes.
How do we encourage the replenishments and the investments?
Yeah. Well, I was going to talk about the mental load, what I call. In Icelandic, we call it the third shift. Where you have some priorities, you have your work shift, and then you come home, and not even the actually doing the dishes or vacuuming the living room or getting the groceries, but remembering that we don't have any milk left, remembering that it's your sister-in-law's birthday, remembering that the kids have soccer practice tomorrow, and they have all of that kind of mental load. In Iceland still, in heterosexual relationships, is by huge majority done by women. And when women are busy, and I think, to speak on your behalf and my behalf, there's a lot of things going on. We're master multitaskers, right? Like, you could ask me right now, what's the schedule for this thing, and what's their allergy, and the names of all their friends. And we don't have, if you find a lump somewhere in the show, you don't think you've got time for that. Or we've been socialized so much to minimize ourselves, not to complain, not to whine, not to take up space. And we don't want to be the people to say, something feels a little bit off with me. And we just don't say it. We don't tell anybody. And I think that, again, has to do with reducing stigma, to know, someone said, put the oxygen mask on yourself before assisting others.
Yes.
And if you're unwell, you can't perform all of these other things that we're trying to do too, but we somehow feel like we have to just run the tank to more than empty in order to be able to perform all of these functions. And I think we need to say that it is okay not to do that. And in the case of, you get a lump checked out, people need to know that this is the case. And allies really come into play with that as well. I happen to know, two people I can think off the top of my head in the last 6 months who've been diagnosed with breast cancer in Iceland. Both of them, their husbands noticed the lump and encouraged their wives, who were like, oh, I'm busy, tomorrow I'll book it, et cetera, to go and get it checked out. And that, again, is really, really important. Men also get breast cancer, of course, but it's all, it's just something that we need as human beings to be looking out for each other and to be understanding and kind to each other. And I think many women, we need to not feel like we are somehow failing ourselves and failing those around us by prioritizing our own health.
Absolutely, I totally agree with you there. And there's a popular notion that the woman is always the broker for health for everybody except for herself.
Yeah.
But there's also this popular perception that breast cancer, despite the data, has somehow, or actually it's a misperception, that breast cancer has somehow already been solved because survival rates are better and screening rates have improved in some parts of the world.
Yeah.
But as we've seen, there's still a significant and growing gap in care and increasing incidence, especially in Black and women and women of color,
Yeah.
that women in rural locations and in younger women.
Yeah.
So how do you think we can overcome issue fatigue and make sure that the leaders are listening to patients when it comes to solutions?
This is a really, really crucial point, I think. Again, in Iceland, we talk a lot about it. We're number one for gender equality. And I think that there is a bit of a tendency there to think, we're close enough. It's what I call the danger of good enough. We had a strike, a women's strike last October, where women and non-binary people were said after 2 o'clock, don't do any work that day, don't do paid or unpaid work to show the effect it has on society. It was a reflection of a strike that happened in 1975 that was incredibly effective, in which 90% of women took part. And I spoke to some people that day and I said, so are you going to go to the strike? You know, our prime minister is going on strike, I was going on strike. And people said, no, I've got to look after my kids that day. And I said, well, how about your husband's? Oh, he's got such an important job. And I thought, this is the danger of good enough. That in Iceland, we live in a very incredibly fortunate society, and people think, okay, maybe I don't earn quite as much as my partner, but it's close enough. Maybe I am not a survivor of gender-based violence, but I don't really see it around me and nobody talks about it, so that's close enough. And I work for a company, and they have a policy that says that they are gender blind, and they've ticked that box, and they never look at it, so that's good enough. And if there's anything we've learned in the last number of years, that all of these hard-fought battles, and that includes in medical research, we can go back in them very, very quickly, as we've seen what's happened in this country with regards to reproductive rights. And if we don't keep our eyes on what's happening, it's very, very easy to fall back. So I think the danger of complacency and the danger of good enough is important. And secondarily to your question, it's that intersectional approach. When I wrote this book on the women of Iceland, I found the word intersectional to be very kind of jargony and very esoteric. And when I examined it, though, it makes complete sense to me. Because we can't say, well, we have achieved these achievements for one group, and the numbers may be abysmal. Maybe only 18% of women of foreign origin who are getting these screenings, but that's close enough. And it's not close enough, and it's not acceptable for any society that purports to have an egalitarian representation as part of its core values. And we need to have those glasses on as well, that if we are not working to look for improvements that include, say, women of foreign origin and women of color and queer women and women with disabilities, then we are not really doing what we say we're going to be doing. And we just have to keep in mind with that and kind of keep on it. And I think that that's why, gatherings like this are also important, because I feel, in a sense, I hope that I'm speaking to the choir a little bit. I hope that many of you agree with me on this. But that doesn't mean that it's not valuable to hear it again, because I hope it gives us that little bit of a spark to leave this room today and to go back and to ask 5 friends when they had their last breast screening, and to ask them to ask 5 other people when they've done it, or to ask your doctor's office how they're promoting it, or to ask your representative official, or to ask your company to do a promotion about it. There's lots and lots of ways to do it.
When we were backstage, you taught me my first word of Icelandic, and that word was sprakar.
Yes.
And it's also covered in your book, and it means outstanding women.
It means outstanding women, yeah.
And I'm so honored to have been joined by Madam Reid yourself today. And I will note that women are truly outstanding as we balance all the duties and all the roles that we play in our lives.
Yeah.
But we also have to remember every day and in every country that women are the backbones of our societies, our communities, and families.
Yeah.
And sometimes, to keep ourselves alive, we actually have to put ourselves first.
We do. That's right.
We need to do more as leaders to make sure that women's health, starting with breast cancer, is at the top of policy priorities for us, for our children, and for our world. And I also want to appreciate you, because as a First Lady, you stood in the breach for every Icelandic woman. You made their issues your issues, and you really did become a very powerful advocate for their needs, and you are continuing to advocate every day positively for women of every shape, size, color. So I want to thank you
can I add two?
Please
sort
do.
of, if there's two kind of messages that I would take away, one is a little bit on that side of, women's health issues are important, and I'd like to add that I'm also happy to see so many men's faces here, because this is a healthcare issue, and we see women on the stage all the time, almost exclusively, and I understand that, it's important, it relates to us, but on a government level, on a policymaker's level, if we are serious about tackling this, we will also put on the stage the people who are making the laws and implementing the policies, and not leaving issues that we think are quote unquote softer issues to the huge majority of spouses who still in this day and age tend to be women. While that is still the case, my second and final point though would be to add, as you say, that we all have our voices to use. And I grew up on a farm in Canada and can tell you that I never expected I'd be married to the head of state of a country I'd barely heard of when I was growing up. But you can either use that voice and use that platform and hopefully shine a light on some important issues, or you can squander that opportunity. And all of you in your lives are going to encounter those moments when you can kind of lean into an uncomfortable feeling and impact change, or just sit back and think it's good enough the way that it is. So think about which way you'll go.
Thank you very much, Eliza Reid, for using your moments so productively. And thank you to AstraZeneca for supporting this very important conversation, and to all of you for joining us. Thank you very much.
Thank you. Tack för det.